A new partnership between HealthLink Alberta and 4 primary care networks is helping Calgary and area residents gain access to a family physician after hours. The Primary Care Network After Hours program is designed to help people who either don't have a family physician or can't access their regular family physician in a timely fashion. HealthLink Alberta, the province's 24-hour health advice and information service, can refer callers to an on-call PCN physician or an after-hours clinic operated by one of 4 local PCNs. Dr. Sonia Reguer is a family physician with the Calgary West Central Primary Care Network.
The PCN runs a program called the After Hours Clinic, and we run that weeknights, 5:30 to 9, and weekend afternoons. And patients who call into Alberta HealthLink with a medical concern will speak to a registered nurse, and if the nurse feels that the patient needs to be seen by a family doctor within 24 hours, they can refer the patient to our After Hours Clinic. We receive their notes by fax, and we contact the patient to offer them an appointment. They can then be seen, that evening or afternoon by one of the After Hours PCN doctors here.
Patricia Beavers recently accessed care through Alberta HealthLink's referral to the PCN After Hours program after her daughter Grace developed a severe case of eczema.
This was the first time I had experienced the after hours service that they provide, because I called at 7 o'clock at night. Grace was really sick with eczema. The nurse called me back within 10 minutes and said that I had an appointment at 8 p.m. She'd established where I lived and which clinic would be closest to me that provides this service, and there was no wait time. I called at 7, I left the house, I came in at 8 p.m. and the doctor was there and I had an appointment.
HealthLink Alberta has been working with Calgary area PCNs to support after-hours services since 2005 and makes nearly 12,000 referrals a year.
If they need some advice about that health concern, they can call HealthLink and a registered nurse will assess the symptoms and find out what's going on. If they're found to have an urgent problem, so something that needs to be seen probably within the next 24 hours, a referral can be made to an after-hours primary care network.
In my experience, it's generally infections and injuries, and I've noticed one of the most common things is babies or young children with a fever and a rash, and then there's the concern, is it measles or that kind of thing. And I think it's because a rash is pretty hard to diagnose over the phone by the HealthLink nurses. So that's a case where it's nice to have quick access to a family doctor that can actually examine the patient.
I was relaxed when I saw the doctor. She looked at my skin. She was very helpful. She said a lot of things positive. I would have been a lot more stressed if I had to wait.
I appreciated the service that I could just come. They set the appointment up. They find a clinic that's closest to your house. I think it's around 50 minutes away from me driving. It's better than me taking her to Emerge and sitting for 3 hours waiting to see a doctor. It's just a fabulous service, so I called and thanked them.
HealthLink Alberta receives more than 750,000 calls annually and provides information on health concerns and symptoms, as well as on local health programs and services. HealthLink Alberta is looking to define longer-term direction and strategies. The Calgary program is one that will be reviewed to determine if what works locally will work on a larger scale.